Medical Dialogues presents Health Dialogues show. I am Dr. Nandita Mohan, and today I will be speaking to all of you about some very common orthopedic problems you would have or might experience in the near future. Now, COVID-19 has changed the way India works, with a vast majority of professionals working from home since the pandemic broke out. Now, when working from home, sitting for long hours can actually contribute to several health issues associated with your back, your knees, shoulders, and even much more. However, with this work from home being the new normal, it is important for all of us to undertake necessary precautions for keeping these problems at bay, and also at the same time be aware of the effective ways of managing them in case we experience them. So to give us some important tips to manage the 5 most common orthopedic issues one might experience, we have with us today Dr. Syed Imran, who is a renowned orthopedic in Bangalore. He is a committed professional who prioritizes the need for his patients above all else. Dr. Imran specializes in joint replacement procedures, arthroscopic surgery, and even trauma cases. He possesses extensive expertise in diagnosing and managing complicated procedures, and he has received specialized training in Endoclinic, Germany, which is the largest center in Europe for joint replacement. Dr. Imran has been privileged to contribute at prestigious hospitals, and he remains up to date with latest advancements in surgical techniques and technology, ensuring the utilization of the most advanced and safest approaches. Welcome to Medical Dialogue, sir. We are really happy to have you on board here with us today.
Good afternoon, everyone. Thank you, Dr. Nandita, for having me here. It's a pleasure to be associated with you on a Monday afternoon.
Great. So, sir, keeping the new normal, that is the work from home culture in mind, if you can briefly explain to our viewers the 5 most common orthopedic problems one can actually experience.
Yeah, COVID-19, threw the world at a completely back foot, wherein there were new things that the entire world experienced. With respect to the orthopedic point of view, working from home became a new norm for most of the things, and of late, I think hybrid models are started. Because of the limited mobility that most of the people experience, the 5 most common problems that I have seen in my own clinical settings are: one is the back pain, second is the muscular aches, shoulder pains, knee pains, and the hip pains. All of these became quite common post the start of starting work from home culture.
Very true, sir. These are the 5, I think, most common illustrated pains that has cropped up since the work from home culture has taken into place. So if you're talking about back pain, if you're talking about it in a little bit of detail, we all know that it is being one of the leading causes of disability globally. So what precautions can one take, and also what home care remedies would you prescribe that can bring immediate relief?
Talking of back pain, it has become one of the most leading causes of disability in the world. And if I were to name one, if I were to ask you to name something which you feel which is present around you, which could pose a health threat to you, most of them would name different things, but most of them will be ignorant of the fact that the most common thing around you, which is giving you the biggest pose to your threat, is your chair. You'd be surprised to know that sitting is called as the new smoking. What does it mean is, when you're sitting and working for prolonged hours of time, it is leading to a lot of drastic effects on your health. We as an evolution, we have not been designed to sit and work. So when you sit and work for a long time, what exactly is long is, what is recommended is you cannot sit and work for more than 30 hours without getting up from your chair. So at every 30 minutes, take a small interval wherein you get off your chair, just take a few turns around your own workplace, and it should reset your entire thing, and you can take your next 30 minutes. And coming to the common things that you can do to prevent yourself from having these back pains is: one is, at every 30-minute interval, move yourself, and sitting on your chair, maybe change your chair positions. And now most of them have the norm of working from laptops. So what happens when we are working from laptops, from ergonomically weaker architecture around us, is we use a laptop, and our head is positioned down, wherein we see people will start having neck pains. So the ideal position for placing your laptop is it should be almost at your eye level, with your shoulders sitting back and your neck centered exactly on your shoulders. You should not be either stooping forward or stooping backward. And preferably try and use a keypad. A keyboard which is an external and not just the laptop, so that you can ergonomically place your laptop. These are the few simple ways with which, by adopting to these small techniques, you can prevent back pains.
Great, sir. I think that was quite a good tip that everybody can, and it's doable. So coming to, as you mentioned, shoulder pains also being one of the most common types of pain that one can experience. What, according to you, are the frequent causes of its occurrence, and when should one actually visit an orthopedic clinician for it?
See, ma'am, the most common cause of a shoulder pain is, again, ergonomically weaker architecture around you. You're sitting, when you're working from home, you're working out of chairs which are not meant for prolonged sitting. So these kind of things, and then your laptop is not positioned appropriately. So these things lead to your neck pain. The neck pain slowly start moving out to your shoulder, and then you're using your keypad and the mouse pad in different angles, and you're keeping your hand suspended for prolonged hours of time as you move your mouse around and all that. So this leads to all these shoulder pains and neck pains. And some of the patients also complain of tingling sensation in the fingers. Some of them have wrist pains, elbow pains, wherein they will have pain even when they lift a glass of water and move a mouse around. And one more most common thing is, even when they turn the doorknob of your office door and push the door, they feel that pain in the elbow. All these are signs which say these are all signs of an overuse injury. Overuse because your muscles are being used quite a lot. So one thing is, you need to exercise properly. Okay, and then the second most important thing is, when do you visit a doctor when these symptoms occur? Because these symptoms are quite of common occurrence. Does not mean that you will have to visit an orthopedician every time you have a pain. The first most common thing is prevention. How do you prevent yourself from occurring all these? Is adapting yourself, studying your own techniques, wherein you need to study as to what are the movements or what are the positions which is aggravating the pain. So prevent yourself from putting yourself in these situations, and then you seek an orthopedician only if the pains continue to persist beyond, say, 4-5 days, in spite of you adopting these changes. In spite of doing an ice pack or a hot fomentation, the pains continue to persist. In case you're feeling a tingling sensation or a little numbness which is going down your hand, and then you feel your shoulder movements are getting restricted, or the pain has reached an intensity wherein your everyday activities, like even holding a glass of water for drinking a water, turning a doorknob is getting painful, that is the time you visit, just to make sure that there is nothing else which could be wrong with you.
Great. Sir, classic examples. I think one can experience all these in the course of their work from home culture. And now that we're talking about that most commonly, so like any other joint in the body, we all know that hip pain also crops up. It is very common. So what is your take on procedures like hip resurfacing surgeries or hip revision surgeries, and even hip replacement surgeries? All of these, even though being minimally invasive, what is your take on them?
The hip pain receives a special mention, especially in the post-COVID era, because some of the patients who have had COVID-19 and who are hospitalized and have been prescribed steroids, there is a condition called avascular necrosis of the femoral head. What does it mean is, because of a steroid intake which was necessary during your COVID treatment, it has led to a complication known as an avascular necrosis, wherein the blood supply to the head of the femur, basically it's the femur joint, the ball of the hip, the blood supply is reduced, which causes pain. So especially if you have had COVID-19, in case you were hospitalized or you were administered steroids, not just for COVID-19, there are many other reasons for which people take steroids. For example, in case somebody is suffering from rheumatoid arthritis, any kind of an immunological disorder, psoriasis, asthma. These are the people who have taken some form of steroids. any form of steroid intake can lead to a avascular necrosis of the head of the femur. So what does this mean is, okay, patients who have this experience hip pain. The hip pain will be present especially when you're sitting and getting up, when you're trying to get on the bike, when you lift your leg up, and then when you're sleeping, when you turn on either side, it leads to a hip pain. So this hip pain should not be ignored and should be tackled earlier. Why should it be tackled earlier? Is, the condition what I'm talking to you about, avascular necrosis, progresses through 4 stages. Stage 1, stage 2, stage 3, and stage 4. Stage 4 requires something known as a hip replacement. If patients can be picked up earlier with an avascular necrosis, it can be, the progress can be curtailed for a certain duration by doing a few interventions. And coming to what Dr. Namita mentioned about what is the role of hip replacements and revision hip replacements. These are surgeries done in cases of patients who have had arthritis of the hip. Okay, the arthritis can be degenerative. Okay. When I mean degenerative, it means hip pain in older age, or it can occur in younger patients, especially in patients who have other diseases like something like ankylosing spondylitis, rheumatoid arthritis. It could even be because of some fracture around the hip region, and of late with avascular necrosis of the hip. But even when it comes to hip replacement surgeries, there's absolutely nothing to be worried about. These surgeries have been some of the most successful surgeries of all time. Okay, my hip replacement surgeries, okay, maybe in the youngest patients, I've done hip replacement as young as 17 to as old as 92. So it's a varied range, and all of them generally do well. Okay, and then the third aspect of the question is revision hip replacements, is what Namita talked about. Okay, revision hip replacements are the next set of surgeries which are done when some hip replacement surgeries which are done have not been performing to their expected capacity, or in cases there is an infection, there is something called as a hip loosening. Then there is the scope of the revision replacements, but till that time, absolutely it is not really necessary. So the only information you as youngsters you need to know is the existence of a terminology called avascular necrosis of the hip, and hip replacements are very successful surgeries. These are the only things I think that need to be known.
Great. Thank you for that information, definitely. So now you also mentioned, if you're talking about the 5 most common orthopedic problems that one can experience, you even mentioned about knee pains. Now it is a common complaint, and it could be said that it affects people of almost all ages. It is a varied range of pain that usually occurs at any age. So are there any self-care measures or precautions that one needs to take to actually be aware or not to get this knee pain at an early stage?
Yeah. So again, coming back to the knee pain, okay, I would divide any person having knee pain, I would like to divide them into knee pain in the young and knee pain in the elderly. Knee pain in the elderly is generally because of degenerative. Okay, when I mean degenerative, it is because of old age, because of an old injury or anything. Coming to knee pain in the young. Knee pain in the young could be in case somebody is active into sports. They have injured a knee while playing, basically snapped a knee. They can have something called as a ligament injury. Okay, the most common ligament which gets injured is something called as a ACL tear. So an untreated ACL tear or not adequately treated tear or meniscal tears can give rise to these knee pains. The other most common patients I see regularly are between 30 to 45-year-old females who complain of knee pain, especially when you sit for a long time and then you get up and then you get off from your chair. The first 2-3 steps are painful. Getting down the stairs is difficult. Say maybe squatting and climbing up is difficult. So these are all indicative that there is an existence of a small terminology called chondromalacia, which basically means there is this softening of your kneecap. It's a very easily treatable condition, does not require anything much. There are grades to it. The earlier you treat it is better. The only treatment which is required is some anti-inflammatory drugs, anti-inflammatory medications, and regular exercises. So by doing regular exercises, actually most of the problems can be solved. Coming to, okay, how do you get your knee stronger, say in an office setting. I think now everybody says I'm too busy to do anything. I don't have time and all that. So within your work sphere, how do you adopt yourself to having more activities? Park your car a little further so that you can have a few more steps of walking. In the office also, every 30 minutes, get off your chair, move around, and then wherever there is an opportunity to use a lift, wherever there's an opportunity to use the stairs, prefer it over the lift. These are small things which you can do within your work sphere, which can prevent all these complications.
Great. That was one good message that you sent out actually. So now that we're talking about work environment, work spheres, you're mentioning about that. So what lifestyle interventions would you recommend to a young or a middle-aged adult to actually mitigate these common orthopedic problems when I'm talking about in the long run?
Coming to the general measures that I think everybody knows about, but I think many of them of late are adopting it, is a healthy lifestyle. By healthy lifestyle, we mean exercising regularly, cessation of smoking, curtailing your alcohol, healthy weight, good dietary habits, keeping yourself quite active and mobile most of the time. These are the simple measures which can be adopted to have a healthy lifestyle. And then, like I told even in the previous thing, okay, marathon sitting is equivalent to your smoking. Okay, marathon sitting is any sitting beyond 30 to 45 minutes continuously in one place leads to a lot of issues, increases your weight. How does it increase your weight? Is research has shown that 30 minutes of sitting will drop your metabolism rate by almost 90%. Most of the people tell me, doctor, I hardly eat, but still I put on weight. The reason they're putting on weight is not, okay, of course, diet does play a role, but along with the diet, when you're not moving around, you're slowing down your metabolism by over 90%. So even if you eat very less quantities, you still have a tendency to put on weight. So keep your metabolisms up, keep moving. Do not sit in one place for a long time, and you will be healthy.
Great. Thank you so much, Dr. Syed. That was a wonderful takeaway message that we can have from here. The pointers that you just mentioned are key factors. I think that everybody, if they can follow and they can have a really healthy life, and they will be orthopedically fit, if I could state it in those words.
Not just orthopedically fit, overall fit.
Yes, overall fit. That is a very good.
Yeah, because when
message.
You say health is not defined just as an orthopedic thing. It is an overall well-being.
Very true, very true. So thank you so much for joining us today. Thank you for all your valuable insights. These tips will take anyone a long way to stay fit and to lead a healthy lifestyle. Thank you so much for all your valuable insights and giving us your valuable time today.
Thank you so much. Thank you all for your time. Thank you for your patient hearing. Thank you.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.